Hi everyone, welcome back to my channel. My name is Shadi Becca. I'm a final year medical student here at the University of Cambridge and I'm just a few months out from qualifying to be a doctor in the UK. There is so much confusion when it comes to the female orgasm, female sexual arousal, and all the fluids surrounding it. Ejaculation, getting wet, squirting. Are they all the same? Are they all different? Is it just urine? Today we're going to talk about it. In this video, we're going to break down what is really going on. So right off the bat, I will go ahead and say that there are 4 distinct fluids that exist when it comes to female sexual arousal. There is lubrication, or otherwise known as getting wet. There's female ejaculation, there's squirting, and then there's also coital incontinence. So I'm going to kick this video off by starting with a quick Q&A session. If you find yourself being surprised by any of the answers or interested in any of the answers from this quick Q&A, I would suggest watching the rest of the video to find out a bit more in depth about what's really going on. Are squirting and ejaculation the same? No, squirting and ejaculation are 2 completely distinct phenomena, but more on that later. What are the differences between getting wet, squirting, and ejaculation? Lubrication, squirting, and female ejaculation are 3 distinct things. And they are different when it comes to what the fluid is made out of and where the fluid is coming from. Lubrication comes from the blood vessels that surround the vagina. Squirting comes from the bladder. Ejaculation comes from the female prostate glands, called the Skene glands. What is squirting? Squirting is an explosive discharge of fluid that comes from the bladder and exits the body through the urethra or through the pee hole. Squirting can happen as a result of sexual stimulation, but the origins of the fluid are from the bladder. Does squirting mean I've orgasmed? Squirting and orgasming can be 2 distinct phenomena or 2 things that happen simultaneously, but you do not necessarily squirt only at orgasm, and you do not necessarily orgasm every time you squirt. I hope that makes sense. Does squirting mean the sex was better? So squirting does not necessarily have to happen at the peak of sex. Squirting can happen during sexual arousal or at the peak of sex. It can happen at the same time as female ejaculation or at different times. But the important takeaway is that squirting is not necessarily indicative of how good of a sex session you've just had. Is female ejaculation even real? Yes, female ejaculation is absolutely real, and unlike porn would love you to believe, it is not the same as squirting. Female ejaculation actually underlies a mechanism that's not that different from male ejaculation, but more on that later in the video. Okay, so let's get right into it and let's start understanding what is actually happening when someone is lubricating, i.e. getting wet, squirting, ejaculating, and actually when someone is having coital incontinence. So let's begin with lubrication. Lubrication, or getting wet, is the accumulation of fluid in the vaginal canal in direct response to sexual arousal. It is well known that sexual stimulation leads to increased blood flow to the penis in men, but actually the same thing happens in women. When a woman is sexually aroused, there is an increased blood flow to the vagina. So the vagina is surrounded by vasculature, which just means that the vagina is surrounded by blood vessels. And when a woman is sexually aroused, more blood flows to the blood vessels. Blood is composed of red blood cells, and the red blood cells are responsible for carrying all the oxygen around the body. But blood is also composed of something called plasma, and plasma is mostly water and proteins dissolved in the water. When a woman is getting wet or lubricating, what is happening is that plasma leaves the blood vessels and moves across the walls of the vagina into the vaginal canal. And this is a process called transudation. This is completely different from discharge, which is coming from the cervix, completely different from squirting, which is coming from the bladder, and completely different from ejaculation. Essentially, lubrication or getting wet is the plasma in the blood moving from the blood vessels around the vagina into the canal of the vagina to reduce friction during sexual intercourse. So when you draw someone's blood and you separate it into the red blood cells and the plasma, you can see that plasma is quite a yellowish substance that is thicker than water. So I'm going to use oil to demonstrate what plasma, or what getting wet or female lubrication might look like. I'll be right back. So here I've just got a small amount of oil, and you can see that it's kind of a pale yellow, got a pale yellow tinge to it. Plasma is not actually as thick as oil, but this will do a good enough demonstration. This is sort of what we expect from female lubrication. So now let's move on to female ejaculation. So female ejaculation, in my opinion, is the least well understood when it comes to all the fluids that happen when a woman is sexually aroused. It's not uncommon for people to think that female ejaculation is the same as squirting. They are completely different. To understand what female ejaculation is, it's useful to understand the female anatomy a little bit. So I'm going to put up a diagram now, and if we were to look at the female genital sort of head on, so this camera right now is me looking head on at the female genitals. At the bottom, I would see the opening of a vagina. At the top, I would see the clitoris and the clitoral hood. On either side, I would see labia, so the inner flaps are the labia minora, the outer flaps are the labia majora. And then just below the clitoris, I would see a small hole, and this hole is called a urethra. And the urethra is essentially the pee hole, where your pee comes from, where your urine comes from. On either side of the urethra, there's an even smaller opening, and this is the opening to a gland called the skein gland. And the skein gland is also known as the female prostate gland. During sexual arousal, the skein glands produce a small amount of thick white fluid that exits the glands through these openings and then exits the body. That is female ejaculation, not squirting. That 1 millimeter of fluid that exits the skein gland on either side of the urethra is actually what female ejaculation is. Now, to demonstrate what this might look like and how much of it there is, I'm going to use a small amount of thick white fluid on a teaspoon and show you. This is what we're talking about. That is what female ejaculation kind of looks like. This is soap, so YouTube, do not block this video. But as you can see, this is not a huge explosion of fluids that porn attempts to depict female ejaculation to be. Female ejaculation and squirting are not the same. Say it with me. Female ejaculation and squirting are not the same. What's even more interesting is what that fluid is actually made up of. So the contents of female ejaculate is actually pretty similar to the fluids produced by the male prostate gland that enters the semen during male ejaculation. The fluid contains something called PSA, or prostate-specific antigen, as well as some sugars such as glucose and fructose. The skein glands are actually very small and don't have a lot of musculature surrounding them. This means two things. The amount of fluids that the skein glands can produce is very minimal, so when a female ejaculation occurs, it's usually 1 millimeter of thick white fluid. And the second thing, in terms of it not having a high amount of musculature, is that it's not really capable of producing this strong contraction to produce this squirting of fluid. You just leak this white sort of fluid from the openings of the skein gland to the outside world. There's not an explosion, and so most of the time you don't actually notice. It can occur with orgasms, it can occur with squirting at the same time, and sometimes it occurs without you even noticing, because as you just saw, it's a very small amount of fluid, and so it's actually much more of a subtle and low-key event that occurs. The main takeaway point from it is female ejaculation is not the same as squirting. Okay, we finally come to the part of the video where we can talk about squirting. What the hell is squirting? If it's not getting wet, if it's not ejaculation, what is squirting? So squirting is not the least researched area when it comes to fluids produced during female sexual arousal, but I do think it's the one that has the most confusion surrounding it, and I think this is for two reasons. I think this is because people often conflate squirting with female ejaculation. And I think porn is to blame for so many things, but porn is to blame because porn creates this association between orgasming and squirting, ejaculation and squirting, sexual pleasure and squirting. I'm going to tell you exactly what's going on when someone squirts. Squirting happens when a filled bladder very quickly empties as a result of the muscle that surrounds the bladder contracting in a pulsatile fashion in response to sexual arousal. I said that in a very scientific way. I'm gonna explain more simply what I mean by that. Right now, you are looking at a picture of a filled bladder. The entire bladder is surrounded by a muscle called the detrusor muscle. In some cases, sexual stimulation can lead to that detrusor muscle squeezing in pulses, and what happens is it causes the bladder to empty in pulses, and these pulses can come out as squirts, analogous to someone sitting on a toilet, squeezing and then stopping, squeezing, and you kind of get it. That's what's happening when someone squirts. So in contrast to female ejaculation, this can be tens to hundreds of millimeters of fluid. And this fluid can range anywhere from clear, see-through, to yellow, just like urine can. So when it comes to squirting, it can be a clear fluid like this. And there's quite a lot of fluid in here because there's quite a lot of fluid that can be expelled during squirting. So it's just clear fluid. It has the same thickness as water as urine because, in my opinion, it's urine. Or it can look a bit more like this. So this is more yellowish in color, and whether it comes out as clear or whether it comes out as yellowish just depends on the context. But either is fine, both are normal. They're just different dilutions of urine, essentially. It comes from the kidney, gets stored in the bladder, and then exits the body through the urethra or the pee hole, just like urine can. It contains uric acid, creatinine, and urea, just like urine does. Essentially what I'm trying to say is it is urine, but there is a point in research where this is slightly debated. The research behind this is quite unclear whether squirting is straight up urine or diluted urine. And there are two extreme scenarios that I can use to exemplify why there is this debate. So in scenario one, you have someone that is not that well hydrated, has a full bladder, does not empty their bladder, goes and engages in sexual activity, and squirts. And in this scenario, it's not that surprising to expect that squirting might look more dark yellow, what it looks like when you pee when you were dehydrated. Because the contents of that bladder that are released during squirting are the same contents that would have exited if you decided to pee before sex, or would have been the same contents that would have exited the body if you had not squirted and then peed after sex. So before sex it was urine, after sex it was urine, it came out during sex. I don't know if there's that much of a debate whether that's urine. Scenario two is where it gets a little bit more interesting. So here you have a hydrated individual and they have a full bladder, but they empty their bladder before sex. They then engage in sexual activity and then their bladder becomes full again and they squirt. And in this scenario, you might get someone who squirts completely clear, odorless and tasteless fluid. Is it still urine? I'll kind of explain what's going on here. During sex, there are changes that happen in your blood pressure, in signaling systems, and in the hormones that are part of the system that regulates the fluid balance in your body. All of these changes can lead to essentially the process of producing urine through the kidneys being sped up. And so during sex, your bladder can very quickly fill up. And then that same bladder muscle, the detrusor muscle, can then contract to very quickly empty it. So the process of producing fluid in the bladder and emptying fluid in the bladder is essentially sped up. In my personal opinion, just because it's a sped up process does not mean that it's not urine. It might be diluted urine, but diluted urine can happen outside of sex too. So for me, it's just a case of semantics. I'm just passionate about making this point specifically because I don't want squirting to sound like this magical phenomena that's reserved to the few selected sex goddesses who are partnered up with absolute beast performers, and those are the people who squirt. Essentially, what I'm saying is, if we look at it from a biochemical perspective, the contents of the fluid in a squirt are the same as urine, and physiologically what's happening is that your bladder gets full and then your bladder gets emptied. Then essentially, for the people who don't squirt, have not squirted, will not squirt, which some people do not, it's just a case of saying, there's nothing wrong with you, your bladder just didn't empty during sex. So talking about emptyings of bladders during sex, this is a perfect segue then to talk about coital incontinence. So from everything I've just said, you might now be wondering, am I just peeing myself during sex? Is that what's happening? Just tell me, am I just peeing myself during sex? No. Is the simple answer. Accidentally peeing yourself during sex is in a separate category called incontinence. Coital incontinence is involuntary emptying of the bladder during sexual arousal that is not a direct response to sexual arousal, but due to some other kind of pre-existing incontinence. Again, I've said this in quite a scientific way, so I'll just break it down a little bit. So some women can experience incontinence for various reasons. Two important reasons to consider here are called stress incontinence and overactive detrusor muscle incontinence. So stress incontinence essentially happens every time the pressure inside of your abdomen or inside of your tummy increases. So this can happen when you cough, when you sneeze, when you laugh, and if you have a weak pelvic floor muscle, this can lead to leakage of urine, and this is called stress incontinence. In overactive detrusor muscle incontinence, what's happening is your detrusor muscle, so your bladder muscle, is basically overactive and contracting way too much during unnecessary moments. If one of these pre-existing incontinences occur during sex, we can call it coital incontinence. This is not your bladder muscle contracting in response to sexual arousal like it does when you squirt. This is pre-existing overactive detrusor muscle activity, and so you can experience this incontinence during sex or outside of sex, but when it happens during sex, it's called coital incontinence. Stress incontinence, similarly, is something that can happen during sex or outside of sex, for example, when you cough, laugh, sneeze, and particularly affects women who have given birth before. When this stress incontinence manifests during sexual activity, we can call it coital incontinence. So squirting is detrusor muscle contraction that are directly linked to sexual stimulation, whereas accidentally peeing yourself during sex is related to having either a weak pelvic floor muscle or pre-existing detrusor muscle overactivity that leads to incontinence also outside of sex. And if this is something that you're experiencing, this is definitely something you can speak to your doctor about if it's something that makes you feel uncomfortable, particularly if it's something that manifests outside of sex as well. There are medications that can be taken, and there are also physio exercises that can be done to help with this problem. So I hope that was an interesting video. If you enjoyed this video and want to see more content like this, subscribe and turn on the notification bell so you actually get a notification when I publish a video. If you found this video useful, then make sure to like the video so that it gets recommended to people just like you. Apart from that, I don't think I have anything else to say. I just really hope it was useful, and I will see you in the next video. Goodbye.